In this episode, COVID-19 live situation updates from across North America. The Ontario government pleads residents to stay at home. Riza Mangilit reports in Toronto, Canada. Texas approves a ban on utility shutoffs during COVID-19 crisis. Nanita Manaus in Dallas, Texas. Canada further restricts people who are self-isolating. We'll have Thomas Likeness in Edmonton, Canada. The DC, Maryland, and Virginia region is on a stay-at-home order. Eagle News correspondent May Ramos reports in Washington, D.C. A Seattle nurse chooses to be part of the solution than the problem. We'll have Mike Hudson in Everett, Washington. Los Angeles County communities comply to the Safer at Home mandate. Marites Herreria in Granada Hills, California. We'll also have live video interviews for you with Raquel Edrelin, a nurse manager in Queens, New York, about how it is to be a frontline health worker with patients belonging to the high-risk category. And with hobbyist Eden Blasco Umbal in Miami, Florida, on how to spend time at home more creatively. Plus, we'll learn the art of diamond painting. And Seth Paraz in Panorama City will teach us how to make stickers. You are watching the EBC International coverage of the coronavirus COVID-19 pandemic North America edition. I'm Anna Cui, coming to you from Las Vegas, Nevada. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 4 p.m. today, there are a total of 775,306 cases worldwide. This includes 159,184 cases in the U.S. and 7,310 in Canada. Worldwide, there have been 37,083 deaths. 164,435 patients globally have recovered. Now, let's check in with our Eagle News correspondents from across North America. In Canada, the Ontario government pleads residents to stay home. We'll have Riza Mangilit in Toronto with the details. Riza?
Riza Mangilit, and I am reporting from Toronto, Canada. Here are the latest updates in regards to the COVID-19 crisis. In Canada, there are about 6,300 confirmed cases and 66 deaths. Here in Ontario, there are 1,355 confirmed cases and 23 deaths as of today. Also, it's been reported at Bobcaygeon, a small town in Kawartha Lakes here in Ontario, 9 residents of a long-term care home facility have died today. 3 more residents and 14 staff members of this facility have also tested positive for COVID-19. This tragedy has given attention as to how Ontario can protect its senior citizens who are considered as most vulnerable to this virus. Prime Minister Justin Trudeau stated in his press conference today that about 10,000 people are getting tested each day in Canada as the virus evolves, and so does Canada's swift response to help support its citizens. The Prime Minister also announced today that the employment insurance and emergency support benefits are now combined into what is called the Canada Emergency Response Benefit, which will provide $2,000 a month for 4 months for those who have lost jobs at this time of crisis. He said that Canadians will receive this assistance 10 days after applying for this benefit. Premier Ford emphasized the importance of everyone's support in slowing down and buying the province of Ontario more time to help control the surge and ease the pressure of our hospitals. He expressed disappointment that this past weekend, a good number of people were still out in streets, socializing. Premier Ford urged everyone to reconsider and change their habits to help protect themselves, their families, and their communities. Premier Ford expressed that every hour, every day, every second of the day that people stay home, they are helping ease the pressure off the healthcare system. He strongly reminded that staying home saves lives. In Toronto, Riza Mangilit, Eagle News, we live in interesting times.
Thanks, Riza. I just have one question for you. The assistance Thanks, Riza. Texas approves a ban on utility shutoffs during COVID-19 crisis. We have Nanita Manaus from Dallas, Texas. Nanita?
Keeping our power or electricity on is very vital, especially during these days where everyone is encouraged to stay at home. On March 26, the Texas Public Utility Commission approved an order to suspend service disconnections for at least in the next 6 months to eligible Texas residents. This commission order addresses the effects of COVID-19 for electric services provided in the areas of the state of Texas that are open to customer choice. Only residential classes will be eligible for the COVID-19 Electricity Relief Program and suspension disconnection for non-payment. According to the TXU Energy website, one of the area's largest retail electric provider, Texas residents who receive assistance through the Supplemental Nutrition Assistance Program or SNAP or through Medicaid are automatically enrolled to the program. Those who have filed for unemployment with Texas Workforce Commission also qualify. In Dallas, Texas, I'm Anita Manawis. Eagle News, we live in interesting times.
Thanks, Anita. An object lesson on why we need social distance in Canada further restricts people who are self-isolating. We have Thomas Likeness in Edmonton, Canada. Thomas?
Good evening, Anna. How's things in Vegas?
Well, it's the same everywhere, I think, but we still have a lot of people out in the streets as well here, as Riza reported, where she is. How about you? How are you doing?
Fine, except I'm freezing here. It's minus 14. We're expecting 5 or 6 inches of snow overnight.
Wow.
I guess it's a good thing we're kind of self-isolating here and staying home. And with nobody walking around, I don't have to clear the sidewalks tomorrow. Anyway, what I'm about to tell you is one reason why we have to self-isolate, why we must keep our distance. We begin with some sad news today. Our chief medical examiner, or medical officer of health, Dr. Dina Hinshaw, tells us there were 5 more deaths in the last 24 hours from COVID-19. That brings the total in the province to 8. Here's Dr. Hinshaw.
This news is heartbreaking for all of us. Although these individuals had risk factors like older age or chronic medical conditions, their lives mattered as much as any of ours. This has been one of the hardest days yet. Imagining the grief that these families are facing, and my heart goes out to them. These deaths speak to the seriousness of the COVID-19 pandemic and why aggressive measures from all of us are needed to contain the spread.
Now, 3 of these deaths were in Edmonton, 1 in Calgary, 1 in northern Alberta. In the last 24 hours, Dr. Hinshaw said 29 new cases have been reported, total of 690 in Alberta. Across Canada, a little over 7,400, 89 deaths. The good news in Alberta, 94 people have recovered. So about 16% of those that have tested positive so far have recovered. But we've got to be careful. Don't get too distracted by the good news. And I'll tell you why that is. I don't want to discourage people's hope. The good news is not a signal that we can ease up. We can maybe socialize a little more, particularly a lot of groups having their cultural celebrations coming up. And Dr. Hinshaw will be talking about that in a moment. But first of all, the rules for self-isolation are being tightened across Canada despite the recoveries. Hinshaw says this decision was made after meeting with her colleagues from all of the province so that these new rules will apply anywhere and hopefully reduce the risk of infecting anyone. And here is Dr. Hinshaw again.
This means that if you are under mandatory self-isolation, you can no longer go for walks in your neighborhood, at the park, until your self-isolation period ends. Do not have visitors over. Do not go to public areas and spaces or community settings. Arrange to have someone pick up essentials like groceries or medication for you.
Now, most people in the province are following this. 95% of the people are compliant. But it seems like we put 95% of our efforts on that other 5% who think the rules just don't apply to them. I'll give you an example. In the small town of Thorsby in central Alberta, it's about an hour from where I live. The mayor is so steamed about someone who came back from vacation just a few days ago, and instead of saying home, this guy drops by the town hall. Why? He wants to check on his water bill. So the mayor has written a scathing letter to the local newspaper. I can't even quote some of the language that is in that letter. And Rod Raymond defended this letter, saying he had to be rude because for some people, that's the only way you can get their attention. You know, the bottom line is we're at war. We're fighting an enemy we can't see. And our strategy has to be to make sure that enemy cannot spread its way throughout the population. And I know I'm preaching to the choir here because Eagle News fans are responsible. I know you people that are watching this are keeping your distance and practicing that social distance. But it's important to get that message across to people you know. So continue to watch anyway. Continue to care for others, care for yourself, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic. Oh, and some of that coverage includes ideas on how to stay sane during this self-isolation period. So listen to some of my Eagle colleagues who are coming up on how to handle the stress of social isolation. In Edmonton, Thomas I. Likeness, Eagle News, we live in interesting times.
Thank you, Thomas. I wonder where that neighbor of yours came, where did he take a vacation from? I mean, this is happening all over the world. I mean, talk about not being, not paying attention to what's happening.
In my part of the world, we have a lot of what we call snowbirds. These are Canadians who, like me, don't like the snow, but unlike me, are independently wealthy. So they go down to the United States for 4 or 5 months and lounge around Arizona or Florida, depending which part of Canada they're from. So they're starting to come back now. It's springtime, and you lose your government health coverage after 6 months. So the clock is ticking. They want to come back, and of course, when they cross the border, the first thing they want to do is go shopping, get some groceries and stuff. You can't do that. You've got to go home, isolate, get somebody else to do that for you, and they don't seem to get it. And sad to say, they should know better. These aren't millennials we're talking about. These are people my age. They should know better. But what can I say?
Yes, so we just have to keep reminding, like you mentioned, we just have to keep reminding everybody to stay at home. You also mentioned earlier, the announcing the recoveries. It should really all the more encourage people to follow, right? Because then it shows that if we do follow, if we stay at home, that we will help flatten the curve.
Yes, the recoveries give us hope, but
yes,
we can't let
exactly.
that hope blind us to the fact that the war is still on. Yeah, we've claimed this piece of ground here, but we got all of this ground over here that we have to claim. It is a war. It is a war.
It is a war. Well, thank you, Thomas. And I'd like to share with you that here in Las Vegas today, it's about 70 degrees. So this is probably one of the places people take vacation. Those snowbirds that you mentioned.
I'm just plain depressed now.
I'm sorry.
Have a good evening, Anna.
All right, you too. Thank you, Thomas. The D.C., Maryland, and Virginia region is on a stay-at-home order. Eagle News correspondent May Ramos reports in Washington, D.C. May?
Thank you, Anna. It's funny, Thomas was just saying about people who can't stay at home because here it seems like business is business as usual. Monday morning in Gaithersburg, Maryland, the cars, we have seen cars along the highway. They're still filled with cars. Hopefully all those cars are on essential trips or jobs. Otherwise, the local government have had enough of people not following orders. In Maryland, a Charles County man was arrested for hosting a bonfire party with 60 guests. In Maryland, the directive is just max of 10. amidst the large gatherings in Virginia, there are still large groups who go to the beach. And in Washington, D.C., there are groups who take selfie on the cherry blossoms after all roads were closed to prevent people from going there. These kinds of acts may just be what the government officials of the DMV or the Washington, D.C., Maryland, and Virginia area region prompted them to issue this stay-at-home directive. The total number of positive COVID-19 cases here are 2,934, and the total fatalities or deaths reached up to 53. In Washington, D.C. specifically, the total number of new cases just this Monday evening is at 94, and the total has reached to 495 positive COVID-19 cases with 9 deaths. Mayor Bowser specifies that the new directive will start April 1 to April 24th. It's the stay-at-home directive, and she says that it will still remain the same. Stay home. Any individuals who violate the order may be subjected to a fine not exceeding $5,000 and imprisonment for not more than 90 days. In Maryland, there are 1,413 total positive cases and 15 deaths. Governor Hogan stated in his press conference that, I quote, "We are no longer asking or suggesting Marylanders to stay home. We are directing them," unquote. This is actually signaling the start of the stay-at-home order for all Marylanders, which we actually all received wireless emergency alert, which the violators may be penalized to a fine of the same as with DC, $5,000 and up to 1 year imprisonment. He also announced the opening of the 4th Maryland drive-through COVID-19 screening and testing sites free of charge for Marylanders only if they have referral from their health care provider. Lastly, in Virginia, there are a total of 1,020 positive COVID-19 cases with 25 deaths. Governor Northam told the people congregating on Virginia beaches that they are being selfish. The stay-at-home order, he said, is effective immediately, but will last until June 10. Although DMV region is waiting and expecting the worst to happen and bracing for the peak of the pandemic, we can see that certain individuals and groups are bringing out the best of our humanity. These actually DC distilleries are making hand sanitizers. You hear stories about Virginia teenager who did 3D masks, which he bought the 3D machines he borrowed from his parents, and Marylanders sewing masks for their neighbors. There's still good thing about everything that's happening now. Here in Washington, D.C., May Bondoc Ramos, Eagle News, we live in interesting times. Back to you, Anna.
Thank you, May. That's really surprising to hear, in the beginning of your report, seeing all these people that are, not adhering to the stay-at-home mandate. I was thinking that maybe, the local governments have maybe not issued enough warnings, but it sounds like they are doing their part. So
At first, now it was just them, as the government was just doing suggestions, as they said, as Governor Hogan said, they were just suggesting at first. When they see groups, they will just ask them to break out, to just go along on their social distancing. But then now they made it stricter. They ask there will be jail time. There will be fines. So this is just to push the people to really stay home, because that's that's how we flatten the curve. We just have to stay home.
Right. So hopefully with the additional restrictions, you'll see less people out in the street doing the things that they're not supposed to be doing.
Hopefully.
Well, thank you, Nanita, for your time.
Thank you.
Thank you for joining us. A Seattle nurse chooses to be part of the solution than being the problem during the COVID-19 crisis. We have Mike Hudson in Everett, Washington. Mike?
How you doing, Anna? Good seeing you. Well, I just want to give you guys current updates for the state of Washington. So according to our Johns Hopkins Coronavirus Resource Center, we have 5187 positive cases and 219 deaths. As many of us already know, we started the mandatory stay-at-home statewide last week, so we're 1 week in. Unfortunately, the numbers are still going up, but there is hope on the horizon that those numbers will start slowing down, and we'll start seeing some results from that. And in addition to that, with President Trump extending the social distancing deadline to the end of the month, April 30th, we're hoping to see a significant decrease in the positive cases as well as the deaths, not only in the state of Washington, but all across the United States. Obviously there's a little give and take in that, meaning, with the many businesses that have to stay closed, especially the restaurants and the small to medium-sized businesses, the financial burden that they're going to have to take is going to be huge. But as far as sacrifices go, that's something that has to be done in order for us to stop this virus. Hopefully, with the stimulus package that will be due within the next 2 weeks, that money can help a lot of these businesses as well as the individuals that have rent due and also other bills that are coming up due as well. Our bureau had the pleasure of interviewing a Seattle nurse who's on the front lines, and I'm telling you, these nurses are they're absolutely just amazing. They're heroes. I saw a quote today that basically said, heroes don't have to wear capes. And, these nurses and these medical personnel, they embody the term hero. And so we had the pleasure of speaking to Reggie Cruspero. I'm out of Seattle. And she first became a nurse because it was, financially rewarding, and it gave her the opportunity to travel the world and see a lot of different things, and also give her the opportunity to exude her compassion and respect to others. So in this clip, we have her discuss as to what she feels when she goes to work nowadays, especially with the COVID-19 virus upon us.
So I am Reggie. I live here in Kent, Washington, our state of Washington. I chose to become a nurse, well, initially because it was financially rewarding. And back then in the Philippines, it's always, a good passport to come out of the country and explore the world. So that was about it before. But then over time, I realized that, it was a very noble profession wherein, it entails a lot of compassion and respect for patients. So that's how I choose still to be in the nursing profession. So, yeah, it is very sad to know that we have this pandemic going on everywhere now. And as frontliner, well, I cannot deny that I feel an extra amount of fear and anxiety when I go to work. But over time, or like when you go there and just do your job, it's being a part of the community and just doing your job, making sure that you become a part of the solution and you are of service to the people in need. So as a parting message for everybody, we have to contribute in making a solution to this problem. I urge that all of us listen and obey as far as what our government is saying. If we have to stay home and be safe, then let's do it. I think the problem here right now is not just the ones who are afflicted with the COVID-19, but more especially for the ones that don't really listen for the advisory of the government. And as far as my family is concerned, we are very vigilant in protecting ourselves, especially me, who is more exposed to this. But with prayers, this is our best armor and protection. And just always pray and have that faith that everything will be good. That's it.
So, as you saw in the clip, Reggie said a very important thing is especially through this tough time, it's important to always remember that we should focus on being a part of the solution rather than compounding the problem. I think it's very easy, especially this time when things aren't going your way, is to just really delve into, the negativity, just giving up and being like, this virus is just going to take us out. No, that's definitely not the answer. We should do what Reggie said and obey what the government is giving us. Like what our great anchors said before, stay home if we need to. If we need to get essential things, get them, but go in and out. But for the most part, just obey, continue to focus on the positivity and the solution. And no doubt in my mind, we'll be able to get through this. So from Everett, Washington, I'm Michael Hudson, Eagle News. We live in interesting times.
Thank you, Mike. That is so true. We have to be the positive voice to everybody. So we have to do our part to make sure that we remind everybody to do that.
Absolutely.
Thank you. Hopefully we see you again.
Appreciate it. Thank you.
Los Angeles County communities comply to safer at home mandate. We have Marites Herreria from Los Angeles, California. Marites?
Thank you, Anna. Hello, everyone. Reporting live here in Los Angeles County, California. We are on our second week of Safer at Home, imposed by our city official, Mayor Garcetti. Unfortunately, we are still seeing a steady climb of those infected by COVID-19. As of today, Monday, March 30th, 2,474 people have tested positive of the coronavirus in the state of California. Death toll from this is also rising, totaling now at 44. Here at our own city, Granada Hills, where I live, it has been reported that there are 9 cases now. Our neighboring city, Northridge, 8 cases have also been reported. But so far, no deaths yet in either cities. I feel that most of the citizens in our community that we live in here has complied with the safer at home mentality, practicing social distancing and only going out to get essential needs. I also believe that closures of schools, restaurants, recreational parks, and malls will contribute in stopping the spread of the virus. With that in mind, my 3 teenagers are bored out of their minds in our home. I know their friends feel the same way because they have their group chat video sessions, and I can hear their conversations. It gave me a chance to also chat with them, and it is clear that they feel the same way. My kids spend most of their times on their phones, PC, or PS4. There are only so much time in completing online homework or house chores. They are not young children where they require our attention. They are very more independent. So my kids will find ways to occupy their time, which it's sad to say, very, very limited. When we get home from work in the afternoon, we allow them to spend time outside. Of course, we keep a closer watch on them more than ever, just to see if they are following social distancing and not touching surfaces with their bare hands if it can be avoided. Typically, my boys will shoot hoops out of our backyards, and my daughter will walk the dog just around the neighborhood. We do limit our time outside fearing being exposed to the virus. We also tried board games and cards, or it can be a binge watch night on movies in Netflix, Disney Plus, or Amazon Prime. I torture them sometimes by watching old movies or classic cartoons. So as you can see, time is longer now for them, and boredom sets in. Of course, we stay positive by always keeping the communication open. We encourage them to ask questions if something is not clear. I have to say this has brought us closer despite the pandemic we are now facing. It allowed us to bring everything back to basic and more time with each other. Very rare with teenagers. In Los Angeles County, California, Mary Tess Hilaria, Eagle News, we live in interesting times.
Thank you, Maritas. And that's so nice that you mentioned, the positive side of this pandemic that's going on, that it's actually brought you and your family together, especially teenagers, right? Because normally they're usually doing their own thing. So, and you mentioned that you're still having to go to work. Is that correct?
Yes, I'm a nurse as well, so I'm on the front line myself. So I feel all of the testimonies just given today. I feel them. It is true what they're saying. So it is hard bringing that back home to my house, and we do take precautions.
That is amazing, because you wouldn't be able to tell in your voice that you're a nurse, which I'm sure you're having to deal with increased stress. Can you tell us? I'm just curious. Being a nurse, is there like instructions for you when you get home that you're doing that's different from what you used to do? Before you used to come home and probably get right in the kitchen and cook. So is there a new habit that you're having to do because of what's going on?
Yes, my boss here, my husband, Paul, has imposed, before I go in the house, I have to take off my work shoes, leave it up on the front porch, take a bath right away, take all my scrubs off, and he'll take care of it. So there are some ways that we can protect ourselves and our family. And it was hard at first because I'm tired. I don't want to do these things. I just want to go home straight to my bed. But I do have to think of my family.
Yes. Well, hang in there, and we're rooting for you. Everyone, as you know, is rooting for all of our frontliners. We thank you. We thank you for your hard work and sacrifice. Thank you, Maritas. ABC international coverage of the coronavirus COVID-19 pandemic will return in a moment. Stay with us.
COVID-19 is an infectious disease caused by a new South. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used,
It's time to take one step further and face the impossible.
Yes.
Time to search the unknown and fight for the truth. Time to overcome boundaries and connect the world. It's time for DW News.
Net25 is now available on OSN, the largest entertainment network in the Middle East and North Africa.
Watch your favorite Net25 shows on OSN channel 725, same day as the Philippines.
Net25 shows live and on demand,
Anytime, anywhere,
on any mobile device on OSN Play.
Accurate and fair reporting. Not only from Batanes to Tawi-Tawi, but also abroad. Detailed and timely stories relevant to people all over the world. Catch all of these at Net25, your reliable source of news, entertainment, and technology updates.
Welcome back. Today, March 30th, is actually National Doctors' Day. So all the more we recognize the efforts of our frontline workers, especially our doctors all around the world. You are watching the EBC international coverage of the coronavirus COVID-19 pandemic. I'm Anna Kui, coming to you from Las Vegas, Nevada. With Eagle News today is a nurse manager at a dialysis center in Queens, New York, who says battling the COVID-19 crisis has been tough because their patients belong to the high-risk category when it comes to getting infected. Let's welcome Raquel Adrelin of Rogozin Institute, Queens Dialysis Center in New York, joining us now via video chat. Raquel?
Hi, Anna. Thank you for having me.
How are you doing, Raquel?
It's been really challenging and scary and actually very heartbreaking to be a healthcare worker in New York these times. 2 weeks ago, we had no COVID patients in our unit, and now 10% of our patients are infected. Half of my staff are also sick, so we have no staff. We don't have enough staff to work. Plus, we're running out of PPEs just like everybody else. So it's really challenging to be a healthcare worker right now, especially in New York.
So it's challenging. You mentioned challenging, but
digital forum is also ABC's response to adapt to the work-from-home initiatives of businesses to avoid the spread of the virus, as we also took advantage of the technology to stay in touch with everyone.
The best way to move forward is to broaden your horizons.
Continue supplying their workforce with the right technology and their business with the right technology, even with the situation now.
It's a good time to really search and canvas for the right brand.
The best time to buy real estate is when the prices are down.
The Filipinos are a beautiful race. You guys are incredible people, and you already get a lot of the principles around relationship and behavior.
Everybody can participate and can start their online business now.
Don't be afraid to try new things.
We are here to assist you and also to call the attention and also na makipagtulungan din sa mga government offices.
Eagle Broadcasting Corporation and Globe My Business present Open for Business Forum. This digital public forum is sponsored by EC Franchise, Multisys Technologies Corporation, and Lobian Realty Group.
Earth, home to millions of species, a home worth saving. Global Ideas tells stories of creative people and innovative projects around the world. Ideas that protect the climate, boost green energy solutions, and reforestation. Using interactive content to inspire people to take action. Global Ideas, the environment series of Global 3000.
Ang COVID-19 ay isang nakahahawang sakit na sanhi ng bagong coronavirus na ngayon palang nakita sa mga tao. Ito ay pangunahing naikakalat ng tao sa pamamagitan gamitin ang tissue, itapon kaagad sa basurahang may takip. Ang madalas na paglilinis ng kamay gamit ang hand sanitizer na may alkohol o sabon at tubig ang pinaka-epektibong paraan upang maiwasan ang bagong coronavirus. Matatagal nito ang virus kung ito'y nasa kamay mo. Manatiling malusog at iwasan ang pagkalat ng COVID-19.
Vulnerabilities for women and children, which we really want to look after because they're such an equal component of society.
ASEAN's Commission on the Promotion and Protection of the Rights of Women and Children, active in all 10 member states, works to see women are treated equally and children everywhere are protected. All 10 nations within ASEAN have signed on to a declaration to end violence against women and children, ensuring their citizens can live freely and safely.
It sets the benchmark of what can be done and should be done. Hopefully we can create a society that is better for women and for children and for families pretty much all over ASEAN.
And by focusing energy on education, ASEAN provides a brighter future filled with opportunities for our children, and that benefits all of us.
Nakakailang kaha ka ng sigarilyo sa isang araw?
Paano niyo po nahulaan? Naninigarilyo ako.
Uy, halatang halata naman eh.
Manghula, di ba kayo, Dok?
Malayo ka pa lang, naaamoy na kita.
Si Pali nang mabaho. Astig naman pag naninigarilyo. Cool.
Hindi astig yun, kuya. At lalong hindi cool. Naka-turn off ka kung naninigarilyo eh.
Inhale, exhale. Naku, malala na ang ubo mo. Hindi karaniwang ubo. Mukhang malaki na ang damage sa baga mo.
Ha? Totoo yun, Dok? Bakit kaya?
Bakit nga kaya malala ang ubo mo at halos mawasak na yung lungs mo? A. Dahil mahilig kang kumain ng gulay? B. Dahil sa pagmamahal mo sa bayan? C. Dahil sa pagtaas ng presyo ng gasolina? O D. Dahil sa paninigarilyo?
Dok, wala bang clue?
O eto ang clue. Hindi lamang ikaw ang napipinsala, kundi pati yung mga tao sa paligid mo.
Ang hirap ba?
Ito pa ang clue. Sinisindihan?
Oo, Dok. Alam ko na sagot. Sige, simula ngayon. Pipigilan ko na ang letter D. Pagtaas ng presyo ng gasolina.
Kailangan mong tumigil sa paninigarilyo. Kung hindi ka titigil sa pagsisigarilyo, ngayon pa lang mag-ipon ka na ng pera para sa ospital at sa funeraria.
Sige po. Simula nga nang mag-ipon.
Ano? Ang ibig ko sabihin, ang sinasabi ko, tigilan mo na yan.
Sige po, Dok. Pigilan ko ng pag-iipon.
Yung paninigarilyo ang sinasabi kong itigil mo. At ituloy mo yung pag-iipon mo.
Sige po. Tutuloy ko na pong pag-iipon ng sigarilyo.
Hindi ako nakikipaglokohan sa'yo, ha?
Dok naman, hindi na kayo mabiro. Nagpapatawa lang naman ako, Dok.
Pwes hindi nakakatawa.
Sige po, ititigil ko na.
Ang paninigarilyo.
Ang pagpapatawa.
Hello guys! Ang ABC Films ay meron na pong YouTube channel, kaya naman iniimbitahan namin kayong lahat na mag-subscribe na at mag-follow. At syempre, i-click nyo na rin po ang notification bell para naman lagi kayong updated sa mga bagong videos ng ABC Films. At yun lang po, maraming salamat.
Ein sonniger Tag heute hier in Berlin vor dem Bundestag. Ich bin Irene Juliet Arzadon und möchte diese Gelegenheit nutzen, um ein paar Worte mit euch zu teilen. An alle Menschen da draußen. In dieser Zeit lasst uns nicht vergessen, den Menschen zu danken, die ihr Leben für uns opfern. Sei es die Menschen, die im Krankenhaus arbeiten, in den Altenheimen sowie in den Arztpraxen, aber auch an die Menschen, die im Lebensmittelhandel sich befinden. Die Kassierer. Manchmal reicht es aus, um ihnen ein freundliches Lächeln zu geben. Denn die Menschen, die heute am Arbeiten sind, weil sie nicht so wie einige von uns zu Hause bleiben können, die sollten wir wertschätzen. Ihnen sollten wir unseren Dank ausrichten. Darum lasst uns noch mehr zusammenhalten. Sie wertschätzen.
Sa dinami-dami-dami, ikaw lang ang tinatanim. Ang nasa isip, lagi-lagi, umaga hanggang gabi.
Maali-aligid lang, patingin-tingin sa'yo.
Ikaw ang buhay at pag-ibig, wala na nang iba.
letters and music. Monday to Friday, 1 to 2 p.m. Only here on Net 25.
Hi, we're continuing our conversation with Raquel Edralin, who is a nurse manager at Ragosan Institute Queens Dialysis Center. Raquel?
Hi, Anna, I'm here.
Hi, so we were talking earlier. I heard that your father is a retired doctor who was possibly called back into service. Is that correct?
Well, he's actually not retired, but he's still actually working right now. But we're trying to get him to not work too much, but he just insists on trying to take care of patients, and we're just kind of telling, Dad, you're at risk, and also Mom is at risk, so you did your part already. Let us do our part now. You have to be careful.
That must be difficult for the rest of the family as well, because having to worry about him and then having to worry about him coming home to your mom. Are they doing anything at home? Maybe, that's different? That's helping?
Yes, they're in separate bedrooms right now, and they're doing social distancing. Yeah, I usually, because my mom has underlying health conditions, and I usually call her every day just to check on her. Now she's calling me every day to check on me. So it's the opposite now.
So you have a really you have a double job, right? You have to keep positive for them and for yourself and your family as well. So speaking of that, how are you? What are some of the things that you're doing, to stay healthy, both mentally and physically? Because that's really important.
Right. You really need to get rest when you can. You need to eat well, and you need to not focus on the little stuff. Just do your best to help your patients, to help your staff, and to help your neighbors as well if you can.
That's right. So you got to choose, let go of the little things, right? Especially these days.
That's right.
Well, thank you, Raquel. What would you say to, maybe government officials or everyone who are viewers right now? What would you like to say to them?
Well, first of all, I'd like to really thank our governor of New York, Governor Andrew Cuomo. He's been such a great leader and inspiration to New Yorkers. His compassion and his humanitarian efforts are just unbelievable, and we're so grateful that we have him. He has our backs. He has the healthcare workers on our backs, so we thank him. And just for everybody out there, follow and listen to what the CDC has to say. Do the social distancing, protect each other, help each other, care for each other, and be kind to one another.
Thank you. That's so true. That is the general message for us too, because it's only together that we will be able to fight and overcome this COVID-19. Well, thank you so much, Raquel, for joining us. Take care.
Thank you for having me. Thank you.
The EBC International coverage of the coronavirus COVID-19 pandemic will return in a moment. Stay with us.
Mga kababayan, lalo na sa mga OFWs sa Middle East at North Africa, may good news kami para sa inyo. Mapapanood na ninyo ang Net25 at iba pang Filipino channels na hatid ng OSN sa presyong abot kaya. Libre ng box at installation, walang admin fees at no extra charges. Saktong entertainment na sakto lang sa budget mo. Bumisita na sa pinakamalapit na OSN store o dealer and subscribe now! sa Net25 at OSN. Siguradong at home ka dito.
Welcome back. You are watching the EBC International coverage of the coronavirus COVID-19 pandemic. Here in EBC, we aim to keep us all connected, even though we need to stay apart physically for now. One way to be connected is to share with each other things that interest us, things we are passionate about. So tonight, to most of us who have no idea what this hobby is, a friend of EBC will introduce the art of diamond painting. Take a look.
Hello from Miami, Florida. I'm Eden Blasco-Umbal, and today I'm going to share with you a fun, relaxing, stay-at-home art project. It's called diamond painting. Let's begin. Diamond painting is a trending hobby that combines the ease of paint by numbers with the therapeutic qualities of cross-stitching. It works by using an applicator to apply colored diamond or gemstone beads onto an adhesive number-coded canvas. So for your diamond painting, you will need the following. Diamond art painting kit. You can get your do-it-yourself diamond painting kit from any craft store or online. I got mine online from Amazon. So this box contains the materials that you need, and also you can use this as a storage when you're done with your project. After removing and setting aside the contents of your package, the craft tray, the magic applicator or the pen with the grip, and the wax. You will need this so your pen will be sticky when you pick up the diamond beads. And of course, the diamond beads, I already cut them and they're according to numbers. You will need scissors and paper tape. I just open it and then put tape, but of course you'll still see the number. The numbers correspond to the color that you will need. And also it will help if you will have extra lamp so you can see it clearly. You see? This is the canvas. This is my current project. It's called Meet Paris. It's an Eiffel Tower, which is actually my favorite place in the world. And it's covered in plastic because it's sticky. It has adhesive, so the beads will stick to it. Place your canvas on a flat, clean surface. Select a single color to start with and place those same colored diamonds in the tray for easy picking. Dip your applicator pen in the wax provided to pick up the diamonds. Note that some kits come with tweezers instead of pens. Hold down the tip of the applicator on the rounded side of the diamond. Peel back the plastic film and firmly press the bead onto its matching symbol. After finishing one color, start on another one and repeat the process until your masterpiece is done. This is actually my first project. I started diamond painting last year and I only finished this one in just a week because it's small, so it's not that hard. It's a rose in different colors. You see that it sparkles. I'm gonna just wait for my other one to finish and then I'm gonna have them framed at the same time. Hope you enjoyed today's diamond painting lesson. Stay tuned to Eagle News for more videos like this. In Miami, Florida, I'm Eden Blasco-Umbal. We live in interesting times. Back to you in the studios.
Joining us live via video chat is our diamond painter and hobbyist in Miami, Florida, Eden Blasco-Umbal. Eden, thank you for joining us.
Hi, Anna. Thanks for having me.
That's really interesting. How did you learn about this diamond painting?
Actually, I saw a store. There's a Marilyn Monroe on display that sparkles like when there's actually a light, but it sparkles, and I'm like so amazed. And then I was curious to know how to do it. So, and then there's an ad in one of the social media, and then I saw like diamond painting, and I'm like, I just realized, oh, that was it. So then I started to order online, and then I started actually last year, and then today, just recently, while we have to stay at home for this COVID, I was cleaning the house and then, organizing my room. And then I saw that I still have one package that I haven't done yet. So then it's actually a perfect time to do it. Now that we have a stay-at-home order.
Yes. So another positive thing of being staying at home is catching up with things that we've always wanted to do, right?
Uh-huh.
How is the the overall pandemic affecting you and your family?
Well, so far it's not really a lockdown situation here in Miami, but we have as much as possible. Most of the people are like asked to stay at home. Only just go out when needed, only for essentials. So we just have to like follow orders, not to like go out and not add to the problems, So so stay at home, be productive, and just enjoy while you're in the comfort of your home, instead of like be like, don't add to the panic. Like we don't do that. Like we don't panic buying. We're just still normal.
Well, hopefully you will stay that way. So besides the diamond painting, what other hobbies, are you do you do that could relieve stress that you can suggest to our viewers?
Well, as you can see, I'm into Hello Kitty collection. So I reorganized my collection. I rearranged the room, so just to give me a good vibes, So when I start my project, my diamond painting, I'm in like a set the mood, like just good vibes.
Well, that's good. By the way, are you still having to work, or are you home from work?
Me and my husband, we're working from home, but unlike him, he's on a normal salary. I'm on a project base now. So because I'm in a film industry, nobody's shooting here in Miami anymore. Because nobody wants to go out. So nobody's renting equipment. So we were asked to stay at home for our own safety, and because there's no business coming in. So we have no choice.
Okay. Well, thank you so much, Eden, for joining us, and hopefully it will stay like that in Miami as long as people are following the stay-at-home mandate. Thank you for your time.
Thank you, Anna.
Speaking of creativity, here's a 9-year-old boy, Seth Paraz, in Panorama City, California, who will share with us how to create our own stickers with very simple tools and materials. Take a look.
Hello everyone, I'm Seth Paraz, and I'll teach you how to make a sticker with only these materials. You're going to need paper, art supplies like markers, double-sided tape, packing tape, scissors, inspiration and imagination, and a sink that has warm water. Once you've gathered all of your materials, you will now need to make a design. You can gain inspiration from your favorite show, your favorite movie, from your mind, or from your surroundings. Don't be sad if you have artist block. Keep trying until you have a design. Once you have your design, put clear packing tape on it. You're going to need to scratch the air bubbles out with a coin or with your fingernails. You can now cut out your design in the shape you desire. You will now be able to run your unfinished sticker under warm water. This step is optional. You can now dry your sticker, put double-sided tape on the back of your design. Stick the back of your sticker onto your desired surface, and there you have it, a sticker. My name is Seth Peras from Panorama City, and we live in interesting times.
A few reminders before we end today. Wash your hands often with soap and water. Cover your mouth and nose while sneezing or coughing. Avoid touching your eyes, nose, and mouth. Avoid contact with sick people. And if you're sick, stay home and call your healthcare provider. Practice social distancing, making sure you keep distance between yourself and others, and avoid crowds. That is today's EBC International coverage of the Coronavirus Pandemic North America edition. Thank you for joining us. I'm Anna Cui. We live in interesting times.
Tandaan ang tamang paraan ng paghuhugas at paglilinis ng kamay upang makaiwas sa iba't ibang karamdaman. Basain ng tubig ang mga kamay at sabunin. Unang sabunin ang mga palad at ang likod ng mga kamay. Kuskusin na maigi ang pagitan ng mga daliri at maging ang mga kuko. Isunod ang pagitan ng mga hinlalaki at kuskusin ng paikot ang mga dulo ng mga daliri sa magkabilang palad.